Hyoid bone is the only bone in the human body that does not form joint with any other bones, and this is very strange, not that we expected. But if that is not enough, the hyoid bone can be used in forensic medicine in determination of cause of death. Then why don't you talk about this bone? What's up, ladies and gentlemen? Welcome back to Neurosketch with Dr. Kenny. But if this is the first time you're seeing this channel, don't forget to subscribe. Hyoid bone is the topic of discussion today, and the way hyoid actually defines its U-shape from Greek letters. Hyoid means U-shaped, and this bone is U-shaped as you can see. But because of being U-shaped, it resembles the horseshoe. It's also horseshoe shaped and can also be referred as the shape of the horseshoe. As we have said, the hyoid bone is a solo man. It does not form any joint with any other bones. It is usually suspended. So how is it kept in spaces? Is usually suspended by a lot of muscles and ligaments. These ligaments, they connect this hyoid bone to the styloid process. The styloid process is this part of the temporal bone. So the temporal bone has got the styloid process here, and this styloid process suspends the hyoid bone through ligaments and different muscles. So these ligaments, because it's coming from the styloid process and going to invest into the hyoid bone, is called the stylohyoid ligament. Stylohyoid ligament, the ligament between the styloid process and the hyoid bones. But you can see also have a lot of muscles that are investing to suspend the hyoid bone, to keep the hyoid bone in space, in space. The hyoid bone is found between the mandible and the larynx. Between the mandible, this is the mandible, and the larynx. The larynx is the vocal box, the voice box somewhere here. We're going to discuss about the larynx at some point, but the hyoid bone is between these two structures, and it is very important. It's situated there, but it is very, very important because it's been suspended by a lot of muscles. These muscles will connect with because it's between the mandible and the vocal box. The muscles that are investing, that are suspending this hyoid bone, will also attach to the mandible, and some of muscles will originate from the larynx, and this also keeps you the clue of the function of the hyoid bone. Yeah, this is the hyoid bone again here. This is a sagittal section to view from the sides, and this is the hyoid bone, and this is the mandible, and this is the vocal box. This is the hyoid bone, this is the mandible, and this is the vocal box. As we have said, a lot of muscles will suspend this hyoid bone. These muscles, we've said, some of them will connect to the mandible here, and some of muscles will connect with the larynx. For example, these muscles that form the floor of the mouth, we're going to discuss them at some point, but muscles that form the floor of the mouth, they also connect to the hyoid bone. They connect to the hyoid bone, and they will have something like hyoid in their name. For example, geniohyoid muscle or something like that. And then this muscle now will help to so the hyoid bone helps to as point of attachment of muscles of the floor of mouth and muscles of the larynx as well, attachment of muscles of the lungs, but also a lot of muscles in the neck region, the muscles that connect the hyoid bone with a lot of structures that we're going to discuss later. Soon after this discussion, I think we discuss about the muscles of the neck, and we see a lot of muscles attached to the hyoid bone. Then because of that special placement of this hyoid bone, it serves as an important way for keeping an important structure for keeping the airway patent. The patterns of the airway is being maintained partly by the hyoid bone, because it connects to the muscles of the larynx, and so it helps to pull these muscles away from the airway to keep the airway patent, and to make sure that your respiration goes smoothly. Goes smoothly. But because it attaches with the muscles of the tongue. This is the tongue. It attaches with the muscles of the tongue, but also the muscles of the larynx. It makes phonation, speaking, talking easy. It makes talking easy by attaching to these muscles. At some point we discuss about the mechanism of phonation, mechanism of speaking, and we see how is speaking maintained, but we see that we have things that should happen in the vocal box here, but also the tongue will also help us to in mechanism of speaking. And all these structures we can see are connected to the hyoid bone, and the hyoid bone now serves as important structure for phonation or speaking. But also because of attachment to the muscles of the tongue, it helps in moving the tongue. Say we still have the muscles like genio grossus or whatever. There's certain muscles that are attaching to the hyoid bone that will help to move the tongue and to make the movement of the tongue easy. And it can also serve as important structure in mastication, swallowing, and preventing regurgitation. The hyoid bone is very important in forensic medicine in determination of cause of death. If the person is found dead in his or her room and brought to you, for example, by a policeman, and they want you to determine the cause of death, the hyoid bone should also be investigated. And if by any chance it's found fractured, it raises the suspicion of strangulation, that this person has been strangulated either by a rope or by manual strangulation. And this has got a forensic repercussion. If the hyoid bone is found fractured in when you are doubting the cause of death, then we know that this person has been strangulated either by a rope or by manual strangulation. And this goes in hand with injuries to the trachea, to the cartilage of the larynx, and they might be found injured or fractured or something like that. You see this person also here, you find your patient, your client who has been brought to you with these markings, and then you do the post-mortem, you find the hyoid is also fractured, then you know this person has been strangulated, and this is the main cause of death. But anthropologists can also use the hyoid bone in sex determination, and this is based on the density of the bone, how dense the bone is, the complexity of the bone. But they can also use the hyoid bone in age estimation, and mainly here depending on the joints between the hyoid bone. If the joints are fused, then it gives you clue that this person is age go kind of a person. Oh yeah, this is what I had for you. And as always, if you have question, additional comment, you can always put your thoughts in the comment section. But if this is the first time you've seen this channel, don't forget to subscribe to keep in touch. We have TikTok and Instagram account. Make sure you go there to relieve your stress. But it was such a wonderful moment having this session with you, and see you very soon. We're going to talk about the muscles of the neck region. Yeah, bye bye.